Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? There is a reason the instructions for prescription suppositories say unwrap and insert and not just insert. I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Me. Okay. I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man, last night at 7 p.m. on the couch. Oh, TMI. I just need to know approximate time to know if Plan B will work. Oh, we have this medication called Plan B, and since the incident happened within 72 hours. Oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me. Unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period. And if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin. Minerals. Food. Me, she's already taken it, which was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me? No, sir. There isn't anything you can take now. I work in home health. At my last job, I had a lady call saying she was returning my call specifically. I don't recall her at all, and when I check for anything on her, it shows we have never received a referral or anything for her. Which I tell her. She gets mad and starts screaming at me. Won't let me get a word in to tell her to call the discharge planner at the hospital. Like a good 8 minutes of her screaming at me, calling me heartless. An idiot. You name it. Whatever. It's slow and these calls are usually good for a laugh. She takes a breath. I say, ma'am, I'm not sure who called you, especially since we haven't heard of you before now. She interrupts with no. It was definitely you. You said your name was Shelaton and you were calling from Advanced Home Health. Ah, we have detected the problem. I tell her I see what's going on. You accidentally called AmberCare Home Health. Let me get you Advanced number. Then she says I have it. They didn't pick up the phone, so I called you guys. 73 here, former clinical microbiologist. Long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-to-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge. Then, I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back patient provided improper specimen. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Had a buddy who was an EMT. He was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Pharmacist here. I had a woman bring in a literal sandwich bag unseparated, which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an apoquel stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag, also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself and to know the directions of how to take it. I've seen her a few times since then, and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. Had a patient who was a farmer who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault, actually was shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. I'm a vet. A few years ago, I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. What do you feed the cat? Owner. Online, trendy raw food brand. Me. How is his appetite? Does he finish what you feed him? Owner. Yes. He always eats everything. How much do you feed him? Owner. 1/2 cup. Me. Once or twice daily. Owner. Once every 3 or 4 days. You only feed your cat twice a week. Owner. I believe in a more natural feeding approach, and based on my research, that's how often cats eat in the wild. This owner was slowly starving his cat to death based on some cockamamie idea he'd made up watching National Geographic. I had to explain to him that domestic cats are not tigers, and that small wild cats eat 10-20 small meals daily. Surprise, surprise, the cat's lethargy and weight improved with regular feeding. I'm in the ER, so many stories. The one that left me dumbfounded was a woman was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her no, because they speak Portuguese in Brazil. Patient seemed relieved, and the sister hustled her out of the ER before I could discharge her. Rural ER doc here. 35-year-old female walks in with right-sided jaw with neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. I used to be a medical oxygen tech, mostly doing in homework. One guy was on such a high concentration that he would have drawn nearly 0 oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on. Literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside our EMC fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Saw a chart once where a person came in for a burn to their eye. They told the DR they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. Optometrist here. If I had a nickel for every time someone said they use urine for eye drops, I would have 10 cents. Which is not a lot, but it's weird that it happened twice. Had a patient come in for facial burns because he smoked while wearing his oxygen. Twice. In the same week. Not me, but my wife, who is a vet. Had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. Lady brings her baby into the ER with a rectal temp of 103. Kid's tatchy as hell and looks like shit. Refuses all medications. Says she doesn't believe in them and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks the children's emergency room just checks them out. Try to explain why the kid needs an NSAID. Keeps refusing. Says she doesn't know what's in it. I bring up that fact she had her kid in a hospital and that she recovered medication herself. Ivor, epidural, etc. Doesn't budge. Only concerned for herself. Told her that when the kid has a seizure or goes unresponsive and you call 911, You can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen. For like 5 whole seconds. Left against medical advice. People like this exist and breed. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of Tennessee. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, well, he's still a virgin, and I'm not sure I'm comfortable with his virginity being taken in a hospital. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like, no clue. My mom usually said something like, how you got it in is how it's coming out, honey. It was the late 90s, early 2000s. I worked ed for 10 years. Every day people come in and it shocks you how they managed to evade death for that long. One of the worst was we had a guy come in. He was a twin. He told us he needed to get checked for STDs because his sister apparently just got one. We of course had to ask if he has had sex with her and he said no, but they were twins, so what she has, so does he. After a collective sigh of relief that this wasn't some weird Alabama you're my sister shit, we had to educate him that is not how it worked at all. Optometrist here. Patient booked in for an emergency appointment with a raging red eye, clearly very painful. Look under the microscope, and the cornea is really not happy, wobbly reflexes, haziness, the works. Me, what happened? Patient. It's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding, light blue. So I used the same dye for both to match the color. Me. Does that hair dye contain ammonia, by any chance? Patient. I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Unless you can convince them to change the color scheme to red. No. EMS here. Had a diabetic in his 30s to 40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugars only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, is this cause of all the ice in my aid? Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a Band-Aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off, it would have clotted enough for him to not end up exsanguinating himself. I worked EMS for years. It never ceased to amaze me, the things people do themselves or others for fun. Confronted with these types, my first question was always, at what point did this seem like a good idea? The weirdest one I can remember was a guy that put his penis through a large metal nut. Once he got erect, he couldn't get it off.